Oxford Physical Therapy at Westchester for my hip flexor injury. So in October of 2018, I injured the left side, my back, and I had to quickly find an orthopedic. My doctor suggested looking at my injury and my history and asked me if I would prefer pelvic floor therapy as opposed to physical therapy, and he said that he felt that they would work best together. He actually suggested, knowing that they did not have pelvic floor therapy available, that I come to Oxford Physical Therapy and work with them. So in October, I was driving to work. I had been having some issues, and my back actually seized all the way up. And I pull over and stop driving. That's when I realized something was really wrong, and it progressed in 36 hours to the point where I was physically unable to walk. I couldn't get out of bed. My husband actually had to physically pick me up and put me in the car. I had a 6-month-old, and I had to stop breastfeeding him. I had to choose, be on antispasms and antinarcotics until your back calms down, or breastfeed your kid. And I figured if I can't hold him, then what good is it to try to breastfeed? I wasn't able to hold him without worrying, is my back going to give out? Is it going to seize up? My hip would lock. I wouldn't be able to move. I'd have to, call for help. It was bad. It just took over my entire body. I was referred to Oxford Physical Therapy. I scheduled my appointment at the Westchester location, and I was able to see Lisa and Jill, and we started working from there. They actually were able to show me that my injury was not actually my back in October 2018, but it was actually my right hip flexor that I've been having issues with since I tore it in 2005. Never fully treated or even known how badly it was injured. So they have been working backwards through a torn hip flexor when I was rowing at a university, through 2 back-to-back pregnancies and all the pressure that put on my hip flexor, a car accident. They have actually uncovered and helped me work through healing all of these problems as we've worked backwards from my left initial injury, where it just gave out from compensating, back over to my actual source injury, my right hip flexor. I've been to a few other physical therapy places before, and it is beyond convenient to come, have my pelvic floor therapy, maybe work with a massage therapist, and then go right out to the orthopedic all in one visit. I can get it done in a lunch hour. And the thing that keeps me coming back, though, honestly, is that they've really taught me about my own body, and they've really helped me understand how this injury that's, like I said, 13 years old, has just kind of like rippled out into all of these other areas, and how we have to work backwards. And I never feel inferior. I never feel stupid for asking questions. They're really patient, and they're super kind when they explain. They don't use a bunch of big words. I don't feel like I'm being dictated, here's how you need to care for your body because you don't know what you're doing. I feel like I'm given power and knowledge over my treatment, and that I think that also helps with success, because you can own it, but you understand it. They've allowed me to get my life back. I know that sounds silly, but just yesterday I was walking at the Columbus Zoo, and I didn't have any pain for the first time, and I don't know how long. I was at the park with both of my boys, and I was able to climb up equipment, monkey bars, and I could run around and chase them, and I haven't been able to do that for all of my 3-year-old life until now. So at least confidently and without pain. It's allowed me to do what I want to, not necessarily anything large or extravagant, but just everything that I want to do on a daily basis. So I would absolutely recommend my family and friends and perfect strangers to come to Oxford Physical Therapy for any of their departments. Everybody is warm and welcoming. I've actually already told my mother and my friend, and I've actually told a perfect stranger at school to come in and seek treatment and help, just even for a consultation, because I know that if anybody's like me and really wants to get better, that they'll walk in through the doors and see that there's an entire team of people waiting to help you and welcome you.